Co-occurring disorders. The link between substance abuse and mental health. When you have both a substance abuse problem and a mental health issue such as depression, bipolar disorder, or anxiety, it is called a co-occurring disorder. In co-occurring disorders, both the mental health issue and the drug or alcohol addiction have their own unique symptoms that may get in the way of your ability to function at work or school, maintain a stable home life, handle life's difficulties, and relate to others. To make the situation more complicated, the co-occurring disorders also affect each other. When a mental health problem goes untreated, the substance abuse problem usually gets worse. And when the alcohol or drug abuse increases, mental health problems usually increase too. According to reports published in the Journal of the American Medical Association, roughly 50% of individuals with severe mental disorders are affected by substance abuse. 37% of alcohol abusers and 53% of drug abusers also have at least one serious mental illness. Of all people diagnosed as mentally ill, 29% abuse alcohol or drugs. What comes first, substance abuse or the mental health problem? Alcohol and drugs are often used to self-medicate the symptoms of mental health problems. People often abuse alcohol or drugs to ease the symptoms of an undiagnosed mental disorder, to cope with the difficult emotions, or to temporarily change their mood. Unfortunately, self-medicating with drugs or alcohol causes side effects and in the long run often worsens the symptoms they initially helped to relieve. Alcohol and drug abuse can increase the underlying risk for mental disorders. Since mental health problems are caused by a complex interplay of genetics, the environment, and other factors, it's difficult to say if abusing substances ever directly causes them. However, if you are at risk for a mental health issue, abusing alcohol or drugs may push you over the edge. For example, there is some evidence that those who abuse opioid painkillers are at a greater risk for depression, and heavy cannabis use has been linked to an increased risk for schizophrenia. Alcohol and drug abuse can make symptoms of a mental health problem worse. Substance abuse may sharply increase symptoms of mental illness or even trigger new symptoms. Abuse of alcohol or drugs can also interact with medications such as antidepressants, anxiety medications, and mood stabilizers, making them less effective at managing symptoms and delaying your recovery. Recognizing a co-occurring diagnosis. There are some general warning signs that you may have a co-occurring disorder. Do you use alcohol or drugs to cope with unpleasant memories or feelings, to control pain or the intensity of your moods, or to face situations that frighten you? Has someone in your family grappled with either a mental disorder or alcohol or drug abuse? Do you feel depressed, anxious, or otherwise out of balance even when you're sober? Have you previously been treated for either your addiction or your mental health problem? The mental health problems that most commonly occur with substance abuse are depression, bipolar disorder, and anxiety disorders. Other mental health problems that commonly co-occur with substance abuse or addiction are schizophrenia, borderline personality disorder, and PTSD. Common signs and symptoms of depression: feelings of helplessness and hopelessness, loss of interest in daily activities, inability to experience pleasure, appetite or weight changes, sleep changes, loss of energy, strong feelings of worthlessness or guilt, concentration problems, anger, physical pain, and reckless behavior. Common signs and symptoms of anxiety: excessive tension and worry, feeling restless or jumpy, irritability or feeling on edge, racing heart or shortness of breath, nausea, trembling or dizziness, muscle tension, headaches, trouble concentrating, and insomnia. Common signs and symptoms of mania in bipolar disorder: feelings of euphoria or extreme irritability, unrealistic, grandiose beliefs, decreased need for sleep, increased energy, rapid speech and racing thoughts, impaired judgment and impulsivity, hyperactivity, anger or rage. The best treatment for co-occurring disorders is an integrative approach, where both the substance abuse problem and the mental disorder are treated simultaneously. Whether your mental health or substance abuse problem came first, long-term recovery depends on getting treatment for both disorders by the same treatment provider or team. Self-help for a co-occurring diagnosis. In addition to getting professional treatment, there are plenty of self-help steps you can take to address your substance abuse and mental health issues. Remember, getting sober is only the beginning. As well as continuing mental health treatment, your sustained recovery depends on learning healthier coping strategies and making better decisions when dealing with life's challenges. Managing stress and emotions. Learn how to manage stress. Drug and alcohol abuse often stems from misguided attempts to manage stress. Stress is an inevitable part of life, so it's important to have a healthy coping skills so that you can deal with stress without turning to alcohol or drugs. Stress management skills go a long way toward preventing relapse and keeping your symptoms at bay. Cope with unpleasant feelings. Many people turn to alcohol or drugs to cover up painful memories and emotions such as loneliness, depression, or anxiety. You may feel like doing drugs is the only way to handle unpleasant feelings, but appropriate therapy and support can teach you how to cope with difficult emotions without falling back on your addiction. Know your triggers and have an action plan. When you're coping with a mental disorder as well as a substance abuse problem, it's especially important to know signs that your illness is flaring up. Common causes include stressful events, big life changes, or unhealthy sleeping or eating patterns. At these times, having a plan in place is essential to preventing a drink or drug relapse. Who will you talk to? What do you need to avoid slipping? Connect with others. Make face-to-face connection with friends and family a priority. Positive emotional connection to those around you is the quickest way to calm your nervous system. Try to meet up regularly with people who care about you. If you don't have anyone you feel close to, it's never too late to meet people and develop meaningful friendships. Follow doctor's orders. Once you are sober and you feel better, you might think you no longer need medication or treatment, but arbitrarily stopping medication or treatment is a common reason for relapse in people with co-occurring disorders. Always talk with your doctor before making any changes to your medication or treatment routine. Get therapy or stay involved in a support group. Your chances of staying sober improved if you are participating in a social support group like Alcoholics Anonymous or Narcotics Anonymous, or if you are getting therapy. Make healthy lifestyle changes. Exercise regularly. Exercise is a natural way to bust stress, relieve anxiety, and improve your mood and outlook. To achieve the maximum benefit, aim for at least 30 minutes of aerobic exercise on most days. Practice relaxation techniques. When practiced regularly, relaxation techniques such as mindfulness meditation, progressive muscle relaxation, and deep breathing can reduce symptoms of stress, anxiety, and depression, and increase feelings of relaxation and emotional well-being. Adopt healthy eating habits. Start the day right with breakfast and continue with frequent small meals throughout the day. Going too long without eating leads to low blood sugar, which can make you feel more stressed or anxious. Getting enough healthy fats in your diet can also help boost your mood. Get enough sleep. A lack of sleep can exacerbate stress, anxiety, and depression, so try to get 7 to 9 hours of quality sleep at night. Find new meaning in life. To stay alcohol or drug free for the long term, you'll need to build a new, meaningful life where substance abuse no longer has a place. Develop new activities and interests. Find new hobbies, volunteer activities, or work that gives you a sense of meaning and purpose. When you're doing things you find fulfilling, you'll feel better about yourself and substance abuse will hold less appeal. Group support. As with other addictions, groups are very helpful, not only in maintaining sobriety, but also as a safe place to get support and discuss challenges. Sometimes treatment programs for co-occurring disorders provide groups that continue to meet on an aftercare basis. Your doctor or treatment provider may also be able to refer you to a group for people with co-occurring disorders. Just make sure your group is accepting of the idea of co-occurring disorders and psychiatric medication. Some people in these groups, though well-meaning, may mistake taking psychiatric medication as another form of addiction. You want to feel safe in this place, not pressured. Co-occurring and denial. Denial is common in both substance abuse and mental health issues. It's often hard to admit how dependent you are on alcohol or drugs or how much they affect your life. Similarly, the symptoms of conditions such as depression, anxiety, bipolar disorder, or PTSD can be frightening, so you may try to ignore them and hope they go away. Or you may be ashamed or afraid of being viewed as weak if you admit you have a problem. But substance abuse and mental health issues can happen to any of us, and admitting you have a problem and seeking help is the first step on the road to recovery.